Time now for the health report. In this evening's edition, Shamela Pullen looks at hernias in children.
A hernia occurs when an organ, intestine, or fatty tissue squeezes through a hole or a weak spot in the surrounding muscle or connective tissue. Dr. Noel McLennan is a pediatric surgeon who has been treating hernias for years. He says there are two main types seen in Jamaica: inguinal, which is seen in the groin, and umbilical, which is in the belly button area. According to Dr. McLennan, at least 5% of the pediatric population is affected by inguinal hernia, and at age 3 to 4, about 20% will have umbilical hernia.
Children who have hydrocephalus, that is an enlarged head because of fluid in the brain, around the brain, and the fluid that is drained to the abdomen by a tube that is put in, that causes increased pressure in the tummy. And children who may have a congenital weakness of the muscle and the connective tissue around the area of the inguinal region.
Symptoms include mainly swelling and pain. The condition should not be taken lightly as it can lead to serious complications.
So the child will not be able to feed as well. The child may be vomiting and the child's abdomen may become distended, as well as a particular portion of the intestine which is involved in the hernia itself. That part of the intestine may lose blood supply and may also get to the point where it is compromised. So in that case, we need to act on it quickly.
Dr. McLennan says hernias cannot be prevented, but knowing the risk factors and modifying them help. However, in most cases, the treatment involves surgery.
There are a few cases where we may be able to watch the hernia and see if it closes or repairs itself. However, this is not usually the practice for inguinal hernias. For inguinal hernias, it is straightforward operation, which is usually done as we call a day case. The child comes in, gets it done, and go home the same day.
With your health report, I'm Shamela Pullen wishing you good health.